Okay, once again, good morning to all. So, today our topic is pharmacology of non-steroidal anti-inflammatory drugs. So, among we today we can discuss regarding the pharmacology of aspirins. Okay, so aspirin, so it is known as the life-saving drugs or life-saving drug. It is the comes under the life-saving drug like dexamethasone. So, already you are familiar with the dexamethasone. You should be remember this name. That is dexamethasone. It is the glucocorticoid drug. Okay, so it is helpful for treatment of the any kind of allergy. Unfortunately or unintentionally, you are given any drug to any person or you are taken yourself. If you are having any ADR or unwanted effect or drug interaction, so on that time immediately you should be managed with the help of the dexamethasone. Okay, so another rule of dexamethasone, so it is helpful for in the case of the emergency, in the case of bronchospasm. So due to bronchospasm or congestion in the lungs, where is the chance of the death or failure of the respiratory tract, due to that the death is confirmed. So due to any entry of allergens or drug induced asthma or allergy or antigen antibody reactions or hypersensitive reaction, if occurs immediately, if for given injection of dexamethasone, so that patient was survive or you can save the that patient's life. So that's why the dexamethasone is known as a life-saving drug. It is the first life-saving drugs. And among non-steroidal anti-inflammatory drug, so the aspirin is known as a life-saving drug because so during the cardiac arrest or heart failure, when sign and symptoms is occurs, that is the pain in the chest or pain in the left arm, so that is the indications of the heart failure. So on that time, if you are given aspirin, so that person was survive or were the cardiac failure is do not occurs because the aspirin it can decrease the incident of the heart failure or cardiac failure because it inhibits the platelet aggregations. So due to platelet aggregation, the blood supply to the heart is stopped. So then gradually when the blood coagulation is started due to platelet coagulations or platelet aggregations or blood coagulation, so on that time the heart was getting less oxygen. So when heart is getting less oxygen, it is under the fatigues. So due to that, certain pain is present in the heart as well as the back of the body or as well as in the left arm. If having you pain means you, it indicates your heart can getting the less oxygen. For example, you can run speedily, okay, due to any dog or any incident, or you want to pick up your college buses, you can run speedily. So on that time you feel some pain is present in your heart, okay, some intense pain is there. Okay, so that intense pain in normal time, you hear you are running, so that's why, so that pain was present in the head. When you are in the normal lifeline or normal styles or locomotion, so on that time, if you are having certain like that pain, so that is the indications of the heart failure or heart getting the less oxygen or heart getting the less blood. So on that time, when the patient having the pain in the heart seriously, or so on that time if you are given aspirin, so then the patient can survive because aspirin can decrease the incidence of the heart failure by avoiding the further blood coagulations because it is a antiplatelet agent. And also aspirin, it can improve the respirations. So as the respiration is improves, so more cardiac output is increases. So then the heart is also getting the more blood or more cardiac output. So due to that reason, the aspirin is also considered as a life-saving drug. You should be remember. So if you are working in the rural area, so on that time any person having the congestional pain, so when you take to hospital, before hospital you visit any OPD or you can give the aspirin. Okay, so then you go to hospitals or to insist to the patient take more aspiration vigorously. Okay, because you're having only hardly 20 to 40 seconds to save that patients. So within 20 to 40 seconds, if the rate of respiration increased by patient itself, If it is unable to respirate by patient means you can give the artificial respiration, that is mouth to mouth. You take the air inside your mouth and give the respiration to that patient mouth without inhaling you. If you are first to take the oxygen and you're inhaling means then your oral cavity containing the carbon dioxide. Without you inhaling, you can hold the air in your mouth, then give the patient's mouth, then automatically so that lungs functions can improve. Once the lungs function is improving, the condition means automatically the heart functions was improved. So then you can take the patients toward the hospital. Otherwise, you directly would take the towards hospital means from Almala to Dilatur, it is a 22 kilometer. Hardly it is required half an hour. So within half an hour, the patient was died due to congestional failure or heart failure. Or if you're having the aspirin, you can give the aspirin immediately. So that aspirin, it can decrease the incidence of the heart failure. So that's why the aspirin is considered as the life-saving drug like dexamethasone. So dexamethasone is also like that. It is a life-saving drug. If any drug interaction occurs, you can give the dexamethasone. So that can avoid the ADR drug interaction, many other allergies. Okay. So now we can learn regarding the for that is the mechanism of actions of non-steroidal anti-inflammatory drug. So first mechanism. So these are mainly inhibit the cyclooxygenase enzyme. So this enzyme is required for formations of prostaglandin and thromboxane A2 from a arachidonic acid. So due to inhibitions of cyclooxygenase enzyme, so not all non-steroidal anti drugs, so they are helpful for the treatment of the fever or pyrexia. And then as well as, so they are helpful for to treat the inflammation and dysmenorrhea because the prostaglandin, it is involved in the to cause of the pyrexia by altering the functions of the thermostat. Or prostaglandin, it can increase the vascular permeability. So due to that, the inflammation is occurs. Or also, it can cause the contractions of the smooth muscle. So due to that, the dysmenorrhea occur. That is the menstrual pain due to prostaglandin F2 alpha. So here, so all non-steroidal anti-inflammatory drug, so they are inhibit the cyclooxygenase enzyme. So due to that, they are helpful for treatment of fever, inflammation, and dysmenorrhea. And also, so they are inhibit the thromboxane A2 formation by targeting the cyclooxygenase enzyme, both COX-1 and COX-2. So due to that, they are helpful for the treatment of the pain, then pyresis, inflammation, as well as, so they are inhibit the platelet aggregation. So due to this property, so they are helpful for the treatment of the congestional failure, or they can avoid the blood clot in the blood vessels. Then second mechanism regarding non-steroidal anti drug, so these are inhibit the lipoxygenase enzyme. So it is responsible for formations of the leukotrienes. Okay, so it is another enzyme. So like COX, so it is convert arachidonic acid into leukotrienes. Then leukotrienes further they are 84, 80, then B4, then C4, like D4, E4. All are they can cause the that is the bronchoconstriction, or they involved in the to cause of the inflammations, or also they can cause the pain and even paralysis. So here the diclofenac, indomethacin, so they can target the lipoxygenase enzyme. Then they are inhibit the formations of leukotriene. So due to this property or mechanism by diclofenac and indomethacin, so they are helpful for treatment of pain or inflammation, or helpful for treatment of asthma, as well as, so they are helpful for treatment of the fever. And the next mechanism, so they are also inhibit the phosphodiesterase enzyme. Example is a indomethacin. So this enzyme is required for conversion metabolism of cyclic AMP into 5-AMP. Okay, cyclic AMP is required for the regulations of the calcium, and this enzyme, it can metabolize the cyclic AMP. Then cyclic AMP converted into 5-AMP in the presence of this enzyme, that is phosphodiesterase. So due to that, the calciums cannot be regulated. So if the calcium is less, the lysosomal membrane is unstable. So due to unstable of lysosomal membranes of a cell or mast cells, so they are released the various autokines. So those are involved in the to cause of the inflammations like histamine, prostaglandin, serotonin, bradykinin. So they are occurs due to unstable of the lysosomal membranes of a muscle cells or cells. And here indomethacin, it can inhibit the phosphodiesterase enzyme. So due to that, they can inhibit the metabolism of cyclic AMP into 5-AMP. Then the cyclic AMP concentration is maintained constant. Then this cyclic AMP, it can enhance the calcium level in the lysosomal membrane. So due to that, that membrane can be stable. Okay, so due to membrane stable, the further the autocyte do not releases. So lack of autocyte, the inflammation automatically it can be treated. So like that, the indomethacin, it is helpful for to treat the inflammation or any other like pain and paralysis, because it also targeted the phosphodiesterase. Due to that, it can stabilize the membrane of a muscle. So due to that, the further the autocyte do not release. So these are the various mechanism of the non-steroidal anti-inflammatory drug. So now we learn regarding the pharmacology of aspirin. Okay, aspirin is the main drug from this class. It is also known as a salicylates or acetyl salicylic acid. So nothing but that is aspirin. So in many exam they ask write the pharmacology of salicylates. That is nothing but the pharmacology of the aspirin. Okay, so first pharmacological action. So aspirin, it is having the irritant in nature. It is acidic in nature. So due to that, it can irritate the tissue. So due to irritant nature of acetyl salicylic acid, it is used as a keratolytics, or it is used as a antiseptic, or it is used as a fungistatics, because it is a irritant to the tissues. So that irritations property of aspirin is helpful for the wound healing, that is the repairing of the wound. So that property are the formations of the new tissues, because so due to irritant, it can precipitate the protein where the injury can occur. So when applying the cream of aspirin on the injury or tissue damage, so where aspirin, it can irritate the tissues. So due to irritations, the protein can be precipitated. So that precipitations of protein is helpful for the clot. Then that clot is helpful for the formations of the new tissue. So that property is known as a keratolytic property. So this aspirin is also helpful for to treat the wound, or it is having the wound healing property. So due to irritant, it can kills the bacteria. So due to that property, it can have the antiseptic actions or antiseptic effect, and also it can destroy the fungi. So due to that, it is used as a fungistatics only due to irritant in nature, because aspirin is a methyl salicylic acid. So that methyl salicylic acid is a irritant in nature. So due to that property, it is used as a catalytic, antiseptic and fungistatics. And next, aspirin is also having the analgesic effect. So the aspirin, it can treat the all type of pain without producing the hypnosis or sleep. So in the market, in the pharmacology, there are two type of drugs are available for treatment of the pain, like opioid drugs. Example is a morphine, codeine, pethidine, or pentazocine. So they can treat the any kind of the pain, but they produces the sleep, or they produces the that is hypnosis. But so other drugs are there. So those are known as the non-opioid drugs. Examples are a non-steroidal anti-inflammatory drug. So here, so these non-steroidal anti-inflammatory drugs, so they can treat the all kind of the pain without producing hypnosis, because they are mainly decreases the prostaglandin synthesis, or as well as they can inhibit the formations of alpha tissue necrosis factor or other cytotoxic factors. So those are involved in the two cause of the pain. As well as aspirin, it can inhibit the pain stimuli in the subcortical regions. So cortex, it is mainly involved in the regulations of the pain. Okay, so here the use of aspirin, it can inhibit the pain stimuli at a subcortical site. So due to that, it is helpful for the treatment of the any kind of pain. And pain is mainly occurs due to increase the prostaglandin level. in that particular part or in the CNS, or increase the alpha tissue necrosis factor or cytotoxic factor or cytokines. So here aspirin, they inhibit the all type of the local hormones. So those are involved in the to cause of the pain. So due to that property, it is having a analgesic effect. So due to analgesic effect, it is helpful for the treatment of the dull ache, then as well as thrombic pain of the muscle and joints. If any twitching is there along with pain due to muscle, so that is also treated with the help of the aspirin. Then as well as it is helpful for the treatment of the dysmenorrhea, and also they are helpful for the treatment of the toothache. If you are having the toothache means, you can take the non-steroidal anti-inflammatory drug with any one antibiotic. If you are taken metronidazole means, so that is a success theory or treatment, so that you can treat the all kind of the toothache. And here, so next pharmacological action, so it is also having the antipyretic effect. So due to this, it is helpful for the treatment of the high fever. So because, so when the entry of the bacteria, so they can cause the liposaccharides. So these liposaccharides, so they can alter the functions of the phagocytes or monocytes. So then they releases the interleukin 1 and interleukin 2 from the, not 2, 6, from the phagocyte cells or monocytes, and these interleukin 1 and interleukin 2 reaches to the hypothalamus, so where they can causes the formations of the prostaglandin, and this prostaglandin, it can alter the functions of the thermostat is a one area, it is made up of the group of the neurons present in the hypothalamus. Its function, it can regulate the body temperature. So due to entry of antigens or due to entry of the microorganisms, so they are releases the various lipopolysaccharides, and these lipopolysaccharides, so they can alter the functions of the monocytes and alter the functions of the phagocytes. Because of phagocytes and monocytes, these are the immune cells. Any foreign substance enter in our body means they are try to kill. So during the fighting, so those micro immune cells, so they are rapture, they are die. So due to that, they can releases the interleukin 1 and interleukin 6. So these two factor reaches to the CNS toward the hypothalamus. So where from the vascular endothelial, so they can cause the release of the prostaglandin. So this prostaglandin, it can inhibit the normal functions of thermostat. Then only we are suffering from the high temperatures. So the aspirin, it can inhibit the synthesis of the prostaglandin, so that can induced by the interleukin 1 and interleukin 6. So due to that, the aspirin is helpful for the treatment of the fever. And aspirin is also, it can causes the or increases the vasodilatations, that is the dilatations of the blood vessels in the skin. Okay, so this is the skin. The skin can consist of the blood vessels. So here what are blood vessels are there, so their size can be increases. So due to increase in the size, so the more blood it can deposited in the skin, and other side aspirin, it can increases the sweating. So due to visiting of more blood, the sweating is occurs. So due to sweating by skin, the excess of the heat, so they can remove from the body. So like that, aspirin, it can decrease the elevated body temperature by initiating the vasodilatations and increasing the sweating. And also aspirin, it can normalize the altered functions of the thermostat in the hypothalamus. So due to abnormalities of thermostat, we having the fever, and aspirin having the caliber, and paracetamol, along with paracetamol, it is also a caliber. So they can normalize the functions of the thermostat. So due to normalizing function thermostat, automatically the body temperature can be normalized by vasodilatations or sweating. So like that, the aspirin, by inhibitions of prostaglandin and increase the vasodilatation and sweating and adjustment of the thermostat, so they are used as a antipyretic agent, or so aspirin is helpful for the management of the high fever. So next one is the anti-inflammatory. So aspirin, it is having the mild anti-inflammatory effect, but inflammation treated due to decrease the prostaglandin synthesis. Already you know from the cyclooxygenase pathway. So prostaglandin is involved in the cause of the inflammation, or thromboxane E2 is involved in the cause of the inflammation. So here the aspirin, it can inhibit the cyclooxygenase enzyme. So due to that, it can inhibit the formations of the prostaglandin. So due to this mechanism, aspirin is helpful for the treatment of the inflammation. And aspirin, it also inhibit the neutrophil aggregation, okay, at the site of the inflammation. So due to lack of neutrophil aggregation, the inflammations can be corrected. So here the aspirin, it also inhibit the neutrophil aggregation. So due to this property, so aspirin once again, it is helpful for treatment of the inflammation. And aspirin, it also decrease the accumulations of the fluid at the site of the inflammations by decreasing the vascular permeability. So aspirin, it can decrease the fluid accumulation at the site of infection or inflammation by decreasing the vascular permeability. So due to these three property, so aspirin, it is used as a anti-inflammatory agent. So next one, so it is also having the anti-rheumatic effect because the aspirin, it can decreases the fibrogen level in the blood. So due to this property, so the aspirin will be having the anti-rheumatic effect. So due to that, it is helpful for the treatment of the rheumatoid arthritis, that is the joint pain or joint inflammation, because aspirin having the caliber to decrease the fibrogen level in the blood. So due to that property, it is used as a anti-rheumatic agent also. The next one, so that is the effect on the respiratory system. So here aspirin, it can stimulate the respirations directly. Aspirin, it can act on the medulla oblongata. So medulla oblongata, it is a present, it is a having a consist of the various centers regarding CVC and as well as the respiratory center. So those respiratory center, they can regulate the inspiration as well as the expiration. So the aspirin directly acts on the medulla oblongata. It can stimulate the inspiration and expiration centers. So due to that, the rate of respiration is increases, and indirectly aspirin, it can stimulate the chemoreceptors. So chemoreceptors, so these are one type of the sensory receptors. So those are present in the blood vessels. So their major function is to monitor the blood chemical composition. So aspirin, it can stimulate the chemoreceptor. Through stimulation of chemoreceptor, once again the rate of respiration is increases. So like that, aspirin, it can stimulate the rate of respiration directly acting on the medulla oblongata or indirectly by stimulating the chemoreceptors. So due to that, it can stimulate the rate of respirations. So next one is the, so aspirin, it is also play important role in the acid base balance and as well as the electrolyte balance. So aspirin in the dose of 4 to 5 gram per day when you're using, so on that time the aspirin, it can cause the respiratory alkalosis by decreasing the excretions of bicarbonate, sodium and potassium. By decreasing bicarbonate, the bicarbonate is more accumulated in the blood. It can react with the sodium molecule, it can form the sodium bicarbonate, and sodium bicarbonate is a buffering agent. It can increases the pH towards the alkaline. So due to more alkaline pH of blood, so that condition is known as the respiratory alkalosis. That is the dose of the aspirin is when you are using 4 to 5 gram per day. But still higher doses of aspirin, it can cause the respiratory acidosis by enhancing the accumulations of the carbon dioxide and by depressing the renal functions. So due to more respiration, so more carbon dioxide was produced. So that can accumulated in the blood. So in the last pharmacological action, so already learned. So aspirin can stimulate the respiration. So due to more stimulations of respiration, the more carbon dioxide can be accumulated. So that can cause the respiratory acidosis. Then aspirin, it also causes the dehydration due to loss of bicarbonate. sodium, potassium, and increasing the sweating and hyperventilation. That is the respiration. Due to that, it can causes the less water content in the blood. So that condition was known as a dehydration. So next one, that is a GIT. So it is a chemical irritant nature. It can causes the nausea, vomiting, hypersecretion, gastric ulcer, as well as the peptic ulcer. Next one is the CVS. In CVS, the therapeutic dose it do not have any effect on the blood pressure, but toxic dose it can causes the decrease in the blood pressure due to vasomotor paralysis. The vasomotor paralysis is nothing but that is the paralysis of the vascular center. So those are present in the medulla oblongata. Is those are also known as the cardiovascular center. So these center it mainly regulate the blood pressure. So here the use of aspirin it can paralyze the or it can inhibit the functions of the cardiovascular center. So due to that the blood pressure is decreases. So regarding the on the blood, in the blood it can prolong the bleeding because it is inhibit the blood coagulations by inhibiting the platelet aggregations. Then another effect it is having the uricosuric effect also. In the small dose, that is 1 to 2 gram per day, it can increases the plasma urate level by inhibiting the reabsorptions of urate from the proximal tubules. So due to inhibitions of reabsorption, it can be it can enhance the reabsorption back to the blood. So due to that, it can increases the plasma urate level. But in the large dose, 5 gram per day, where it can decreases the plasma urate level by enhancing the excretions. So regarding the metabolic effect, it can causes the negative nitrogen balance. So due to that, it is involved in the protein catabolism instead of the protein anabolism, because the protein anabolism or protein synthesis is mainly depending upon the presence of the nitrogen. Here aspirin it can causes the negative nitrogen balance. So due to this property, the aspirin it can increases the protein catabolism. So aspirin in the normal individual it can causes the hyperglycemia. But when aspirin is given to the diabetic patient, where it can causes the hypoglycemia. Okay, so that's why. So when you're giving the aspirin to the diabetic patient, you can monitor the blood sugar level, because those drugs also decrease the blood sugar level, and here the aspirin is also decreases the blood sugar level. So these are the metabolic effect of the aspirins. So now we learn regarding the pharmacokinetics. So aspirin, so mainly administered by the oral route, it is absorbed from the stomach and as well as the small intestine, that is upper part of the small intestines. And in the plasma level, within 30 minutes, it can be reaches to the maximum level. Then it is metabolized in the liver by deacetylation process and excreted through a urine. So regarding the adverse drug reaction, it mainly causes the intolerance, that is one type of the allergy or hypersensitivity reactions, because it is a chemical irritant in nature. Then it is also causes nausea, vomiting, gastric irritations, bleeding, because it is having the anticoagulant property or it can inhibit the platelet aggregation. Then also it can causes the dyspepsia, then peptic ulcer, even it is participated in the cause of the hepatotoxicity and nephrotoxicity. So these are the ADR related to the non-steroidal anti-inflammatory drug as well as the aspirin. So regarding therapeutic uses, so aspirin is also known as the life-saving drug or wonder drug, because it is helpful for the treatment of the various conditions or various disorders. Okay, so aspirin it is mainly used as a analgesics. It means it is helpful for the treatment of the pain, any kind of pain, and without producing the hypnosis. But opioid drug, they also treat the any kind of pain, but they produces the hypnosis or sleep. But aspirin, it is also treat the pain without producing the hypnosis. Aspirin, it is used as a antipyretic. It means it is helpful for the treatment of the fever. Okay, so because it can normalize the functions of the thermostat and decrease the synthesis of the prostaglandin. And aspirin is also used as a anti-inflammatory agent. It is because it can decrease the vascular permeability. So that property was helpful for the treatment of the inflammation. And aspirin, it is also used as a anti-rheumatic agent because it can decreases the fibrogen. So that fibrogen is only involved in the to cause the inflammation in the joints. So due to that, the movement was failed. But aspirin, it can decrease the fibrogen level in the blood. So due to this property, it is helpful for the treatment of the rheumatoid arthritis, are used as a anti-rheumatic agent. So aspirin, it is also used as a antiplatelet agents. So other local applications of aspirin is, it is used as a fungistatics. If you have any fungal infection, especially girls and as well as the those students are there living in the hostels, so they are commonly suffering from the fungal infection. So then simply you keep the one aspirin ointment, because many ointments are there antifungal, but they are causes serious side effects. But aspirin, it is also having the fungistatic effect. If you're having any fungal infection, then you can apply the aspirin. And also after saving in the barber's shop, so then also we are suffering from the infections of the face. So that infection of face due to barber's shop, that is also treated only with the help of the aspirin ointment, and remaining antifungal agent they are fail, but only aspirin ointment, so that can treat the that kind of the infection due to saving in the barber shops. Okay, so then as well as it is used as a antiseptic and keratolytics. Okay, it is helpful for the wound healing also. That's why simply you keep the one aspirin ointment in your home along with you. Then aspirin is also helpful for treatment of dysmenorrhea. That is one type of the pain related to the menstrual cycle due to constructions of the smooth muscle, because the smooth muscles are contracted during the menstrual cycle. That is the role of the prostaglandin F2 alpha. So aspirin, it can inhibit the prostaglandin F2 alpha. So due to this property, it is helpful for the treatment of the menstrual pain or dysmenorrhea. And aspirin is also helpful for to correct the ductus arterus closure, because the ductus arterus closures are open by only PGI2 PGE2 in the womb. Okay, one hole is present in the heart, so that is directly blood enter from right, that is uh, right atrium to the left atrium. So that circulation is made by with the help of the one hole. So that is known as the ductus arterus. So that ductus are still open after birth also. So that can be closed. So with the help of the aspirin, because so that hole was open under the influence of the PGI2 and PGE2. So here the aspirin, it can inhibit the PGI2 and PGE2. So due to this property, it is helpful for to close the ductus arterus. Then as well as aspirin, it is helpful in the parturition, or it can delay the labor. If before maturations of womb the birth is occurs or the labor is occur means, so that is also delayed with the help of the aspirin, because so that parturition is occurs due to excess secretions of the prostaglandin F2 alpha. If it is more mean, so before 9 months the childbirth is occur, that is also harmful to the child as well as mother. So that can be delayed with the help of the certain kind of drugs. So and those drugs are known as the tocolytics. Example is a salbutamol, and same property is also possessed or have by a aspirin. So aspirin is also helpful for to delay the labor, because it can inhibit the prostaglandin F2 alpha. Then aspirin, it also improve the memory or improve the conditions of the Alzheimer disease. That is the loss of the memory. So Alzheimer is occurred due to clot in the brain or formations of the beta amyloid protein due to inflammation. Because here the aspirin is a strong anti-inflammatory agent. It is easily enter in the brain. So due to that, it can improve the dementia conditions or Alzheimer conditions. Then it is also used as a treatment of the rheumatoid arthritis. So aspirin, it is a wandering drug because it is also having the anti-tumor property. It is also helpful for the treatment of the cancer. because one of the molecule of the aspirin after metabolism, it can shows the anti-cancer property. So due to that, in the further years, in coming years, so aspirin may be used as a systematic treatment of the cancer. And aspirin, it is mainly used as a anti-stroke agent. It can decrease the sudden death. So already you can watch the various videos in the YouTubes as well as your WhatsApp group. Okay, so where the person, they plan to withdraw the money immediately, suddenly the death is occurs. So that is not a stroke. So that stroke is occurs due to clot in the brain. So that stroke is also avoided by use of the aspirins. If any person having that kind of symptoms, okay, so that immediately the blank is coming in front of your eye without any problems. So that indicates we are suffering from the stroke problem. So that can be avoided incident with the help of the aspirin. So due to that reason also, the aspirin is known as a life-saving drug. Okay. So it is also decrease the incidence of the heart attack or heart failure. Then